And thank you for joining us here today. Um, a little less than a year ago, we were in this space as we were setting up an Army hospital, field hospital, as we faced this virus in the earliest days with fear and trepidation, uncertainty, not knowing what was coming, not knowing how we would get through this. And it has been such a difficult year for everyone in our city and our region. We have had too many people get sick. Families have lost loved ones, empty places at the dinner table. We've seen the devastating impact on our economy, our workers, our small business. But through it all, we have persevered and continued. And today, we are just thrilled to say and show that hope is really here and on the horizon. It's hard to believe that we're standing in the same building where before the pandemic, there were concerts and auto shows, there were art fairs. It has been a place first for treatment that fortunately we didn't need, and now hopefully for the hope to finally beat this virus. At peak capacity, this will be the largest civilian-run vaccination site in the country. We know that Seattle's road to recovery goes right through the road of vaccinations. That is what's going to give us the ability to reach enough people who are safe to be out. With Lumen Field, we are taking an enormous step forward and reaching our goal to be one of the first cities in the country to reach that 70% threshold of vaccinations. When the pandemic first touched down in Seattle, we knew we had to act quickly to protect the people, the health and safety of our communities. And that's why our city, led by our fire department, stood up a nation-leading testing program, first for first responders, then in our senior centers, and now for throughout Seattle. We've done over 600,000 tests. 1 in 3 Seattleites have been to our testing facilities. And it's one of the reasons why our city has the lowest level of disease and hospitalization anywhere in the country. But we knew that this was going to be hard, but I don't think anyone foresaw how long it would take and how great a toll it would take. We have started our vaccination program again with Seattle Fire Department in cooperation with our hospitals, the University of Washington and King County Public Health, and we've done over 15,000 vaccinations. We operate mobile clinics, pop-up clinics. You've seen them in the Filipino Center. We have permanent clinics now in Rainier Beach in West Seattle. I want to take this moment that if you're over 65 and eligible, go sign up for your vaccination at Rainier Beach in West Seattle because there are openings. Just last week, we were able to say that those would be permanent. And now we know that we have done this week alone 5,000 vaccinations in our community hubs. And I'm also very proud that City of Seattle is making sure that because this virus and because of systemic inequities in our society, communities of color has suffered the most in this pandemic, both on the health and the economic impacts. So at our city sites, we are proud that over 70% of the people we vaccinated identify from the BIPOC communities. The vaccination clinics are really one of the few things now that are just a center of joy. It has been so long since we've been able to come together to enjoy each other, to really have those lives of before. And I had the opportunity to go to some of these clinics, and you see grandparents FaceTiming with their grandkids across the country. Grandkids they haven't been able to see or hold for over a year. It's so important to remember why we're doing this. We're doing it to come together again, not just to open up, but to open up better and stronger and more equitable. That's why I'm so thrilled to announce that this Lumen Field site will be open starting on Saturday. And we will be open for 2 to 3 days a week. Initially, because of supply, we will vaccinate about 5,000 people a week. But at full supply and full status, we will be able to vaccinate over 20,000 people a day. It'll again be the largest civilian-run vaccination site in the country. We've been working with community-based organizations to register BIPOC individuals, older adults, immigrants, and refugees for vaccinations here. But eligible members of the public should know this will be open vaccination site. So if you're eligible, you can sign up at seattle.gov/vaccine. We'll be able to then email you and work with you directly for appointments. We also know there's been a huge digital divide and frustration with trying to make appointments, and many people don't have as ready access to computers and technology or don't speak the language. So we are also making sure that our Community Service Bureau can help people on the phone, and we'll have volunteers. This pandemic has been a once-in-a-generation challenge. It is not something that any individual, any organization, any city, or any county can face alone. It has required all of us and will continue to require all of us. Employers, healthcare providers, philanthropy, community-based organizations, and ultimately the individuals and residents of our great city and great region. That's why I could not be more grateful for the partnerships we have. I have to thank Swedish Hospital and First and Goal for their partnership to allow us the space, first as a field hospital and then for this, and this vaccination site. I want to thank Executive Dow Constantine, who has been just an enormous partner every step of the way through this, together with Patty Hayes and Jeff Duchin of Public Health, who have really made sure that we ground our decisions on science and health. I, of course, want to thank Governor Inslee. He has led our state through this enormous challenge at a time when we had little federal leadership, when there was no playbook, and when we were the first to go. I also, a point of privilege since I go first, I want to thank all the yellow jackets you see here today, the Seattle Fire Department and others. They're from our FAS department, and many people who've been to the testing sites or the vaccination sites. That's the tip of the iceberg. It's amazing work being done. But they are the people who not just set up this facility, but every testing facility, and throughout snowstorms, putting together homeless shelters, emergency stop. It shows that in this uncharted, unprecedented time, we all have a role to play. And the biggest role has been from our residents and our businesses, who have literally made every sacrifice to get us to this place. And while vaccinations are the greatest hope right now on the horizon, please remember, we're not through it yet. I know people are exhausted, but we can't let up. Please continue to wear your mask and socially distance. Get people vaccinated. If you know a loved one, help them make the appointment as soon as you can. On that, I will say, together, we'll make it through this. We will come back better and stronger and more equitable. And there will be a time when we can come together for events that are not an Army hospital or a clinic in this very space, but a time to celebrate as a community. And with that, I'm going to turn it over now to David Young, who will introduce Governor Inslee. Thank you so much.
Thank you, Mayor Durkan. Good morning, everybody. I'm David Young, the Senior Vice President of Business Operations for the Seattle Seahawks and First and Goal, and also the General Manager here at Lumen Field and Lumen Field Event Center. On behalf of all of us here at Lumen Field, we would like to say that we're thrilled to be here today and so proud to be able to host this community effort and this community site here. I'd like to thank the City of Seattle for partnering with us again and for trusting us to host this massive undertaking. I'd also like to thank all of the volunteers, all the healthcare providers, and really everyone at Swedish and all of the rest of our partners who have helped to get this massive undertaking off the ground in such a short amount of time. I'd also like to acknowledge and thank the Washington State Public Stadium Authority. We have Board Chair Fred Mendoza with us and Board Member Joel Ng here today as well, for being our tremendous partners in this and great support in all of these community efforts. And then also our partners at Lumen, our stadium naming rights partner. David Nomura is here today, who have shown such tremendous support through all of these community efforts we've undertaken over the past year. As Mayor Durkan had articulated, certainly Lumen Field and this space here in Lumen Field Event Center is a great space for our community to gather and take place and take part in exciting events that happen here, whether it's a sporting event, a concert, an art show, the boat show, home show, one of the many consumer shows we host throughout the year. It's just a tremendous place to attend an event. And in a normal year, we host many of those, and this facility is rarely, if ever, as quiet as it is right now. But this past year has been anything but a normal year, as we all know. And as our community has struggled and our public events went quiet, you know, we turned this stadium, this event space, into what it needed to be, and that's a community asset, and opened our doors to many community response needs. We hosted a field hospital here a year ago, which thankfully did not need to see a patient. We created and produced and distributed over 120,000 meals to communities in need here in Seattle. We have also and continue to partner with BloodWorks on a blood donation drive, which is going on right now inside the stadium up on the Verizon Lounge. We're always ready to help out our community in any way that we can. It's core to who we are, and it's one of the most important things that we do here at Lumen Field Event Center. It's incredible to witness this space. One of my favorite pieces of my job is just seeing how this space is so dynamic and so many different events that we can put through here and how it looks different. And it's really amazing to me, and I'm humbled by how quickly that this space has been transformed into what it is right now, what you see before you. It's really a good example of the teamwork of the folks that are here in the yellow jackets and the volunteers and those behind me and their teams, and coming together in a quick amount of time for the community. By being able to use this stadium's event center and this massive space for a vaccination center, this gives us optimism for what's to come. The sooner we can stop this pandemic, the sooner we can all go back to doing things that we love, including attending events here at Lumen Field and Lumen Field Event Center. And we look forward to those days and to doing that together. And now I'm honored to introduce our next speaker, Governor Jay Inslee.
Thank you. Yesterday, Washington State was named for the second year in a row the best state to live in the United States. And there's a reason for that. It's because we believe in science and we believe in working together. And because we're working together, we are going to vaccinate Washingtonians like crazy at Lumen Field. And the Sounders, the Seahawks understand momentum. I'm pleased to tell you Washington State's got momentum big time in the fight against COVID. What took us 2 months to get to 1 million, in the last month we've gone to 2 million vaccinations in Washington State. And I'll tell you what, come on down to Lumen Field and save your life and everybody around you's life. It's going to be a great day when we have that happen. I want to thank Dow and the mayor and First and Goal for their efforts working together on this. There's a couple points I want to make about this site. Number one, it is dedicated to give everybody access to this vaccine because they've arranged a mechanism of getting an appointment through phones and otherwise so that those who've had difficulty getting access to get access. We want equitable access of this vaccine. This site is going to make sure that we get it. The second thing is the prodigious productivity of our vaccination sites. We have increased our production by 1 million over the last month, and we are capable of doing this. I'll tell you what, the federal government's helping you. Joe Biden has helped us big time by increasing productivity. You give us the doses, Mr. President, we'll give you the vaccinations. So I want to thank everybody for what you're doing. Let's keep up this great work. Now I'd like to introduce Renee Rassilyer-Bomers, who's the Chief Quality Officer of the Swedish Health Services, a place on February 9th, 1951. My mother did her best work. Good work. Thanks a lot.
Mayor Durkan, Governor Inslee, County Executive Constantine, and our community partners. On behalf of our team at Swedish, it is my pleasure to join you today to talk about our role in developing this mass vaccination site and getting it ready and open to our community. Earlier this year, Swedish partnered with Seattle University to stand up the first community vaccination clinic in King County. At this site, we administered more than 48,000 doses in 7 weeks. We learned a lot about standing up and operating a clinic, and we were able to take those lessons learned and share the knowledge and apply it here at this site. In this next phase of vaccine delivery at Lumen Field Event Center, Swedish will provide clinical support along with other resources and supplies. It will be our responsibility to manage the vaccine and those clinical staff drawing up the doses, in addition to managing all other clinical roles on site. This includes those administering the vaccine and those who will be monitoring our patients in the observation area after they receive their dose. It is so exciting to see the scale here at Lumen. For some perspective, at Seattle University, one of these pods you see here today would be able to vaccinate 2,500 individuals. At full scale, with all pods operational, we will be able to vaccinate 22,000 people in a single day, doses permitting. That comes out to about one person being vaccinated every 4.5 minutes. Accessibility is so important to us for those who are coming in, and we've designated Pod A to my left to support those who need a little bit more time and assistance. We will manage patients one every 10 minutes at this pod. It's separate and closer to the observation space. Our Swedish care teams and those in the healthcare systems in our surrounding area have been on the front lines throughout this pandemic. We are so proud to be part of this work vaccinating our community. We recommend that individuals continue to follow the CDC guidelines, and those who meet the phase eligibility get vaccinated. And over the next few months, we urge everyone to continue wearing a mask, practicing physical distancing, and washing your hands frequently. Hundreds of volunteers, both clinical and non-clinical, have contributed their valuable time and energy thus far in this effort, and numerous Swedish caregivers have volunteered their own time to do so. I want to thank everyone for all that they have done to pull out this vaccine distribution together as safely and quickly as possible. Now I'd like to turn this over to our Executive Constantine.
Well, thank you, Renee, and thanks to Swedish. You know, Renee, Governor Inslee was bragging on being born at Swedish. Governor, I too was born at Swedish Hospital, and my little baby girl, who's now 6, is a Swedish baby as well. We're really grateful to Swedish for their service during this pandemic, and in fact, my folks who are now in their 90s just got their second vaccine at the Swedish clinic at Seattle University so that their little granddaughter can now visit them again. We've all been doing a lot of reflecting. I've been asked to do a lot of reflecting about the beginnings of this pandemic as we've passed the 1-year mark. It was a year ago that we all gathered in press conferences to haltingly talk about what was happening here in our community, what we needed to do. Governor Inslee, Mayor Durkan, our public health folks, we were gathered together as we came to terms with the first outbreak in the country. We didn't have a roadmap. We didn't have, to be fair, a lot of help initially from our national government. But in the year that's followed, a lot has happened to our community. Obviously, far too many are having to grieve the loss of their loved ones, friends, family, who succumbed to this terrible virus. Many of our neighbors are still out of work. And everyone has made sacrifices during this truly trying time. And now 1 year later, we also have days like today, days where we can gather masked still and distanced still, of course, to celebrate achievements like this new vaccine site. The Lumen Field Event Center is the site, as the mayor said, of the largest vaccine clinic of its kind in the nation. And now, with 3 amazingly effective vaccines and supplies increasing, First slowly, and then it looks like much more rapidly as the weeks go by. This facility is a critical piece of our road to recovery. I would add to Governor Inslee's comments lauding the work of the Biden administration, bringing the power of that office to bear on the task of increasing the production and distribution of vaccines is exactly what we have needed. And the President's announcement today of the acquisition of another 100 million doses is tremendously good news for our efforts to get past this pandemic and on to recovery. Having this site and those vaccines to administer, again, in just over a year since the outbreak began, is a testament to the work of researchers and scientists, and also to our community's support for one another. Our vaccination sites around the nation, or around the region, operate really at the intersection of government and healthcare organizations and community. King County is working to ensure that every adult resident can get vaccinated, and we're working with community partners to make that happen as quickly and as equitably as possible. The Lumen Field Event Center will complement King County sites that are already operating at the Showware Center in Kent and in Auburn, and partner sites that we have in Redmond and in Renton, and the Seattle sites that we opened last week in Rainier Beach and West Seattle. I want to thank Mayor Durkan for bringing the vaccine sites to those of us who are marooned in West Seattle. And we're going to be pushing even farther to open in the northern cities and the eastern areas of King County. These sites and our healthcare partners have put some 665,000 doses into arms of King County residents. We have gotten at least one dose now to some 3/4 of those who are eligible, including 3/4 of people over the age of 75, the people who are by far the most likely to become seriously ill or die from this virus. That is a real accomplishment, and we're focusing particularly on race and equity. We've started with our efforts at outreach through community-based organizations and bringing vaccine sites to the most diverse communities in the county to close the gaps in vaccines among our Black and Latinx communities. So I know we're all used to being in the stands or on the field next door cheering on guitar solos or goals or touchdowns. But this vaccination center is another remarkable achievement worth shouting about. One that will support our community and will support our region as we work to get every single adult in King County vaccinated. So thank you. And now I am honored to introduce one of the community partners and community leaders who is helping to ensure our efforts are successful. Rochelle Tanner, who is the board chair of the Urban League of Metropolitan Seattle.
Thank you, Don. Thank you. As chair of the Urban League of the Metropolitan of Seattle, I really speak in behalf of our frontline staff that are working in the community every day. Our communities of color have been getting sick and dying from COVID significantly higher than the white community. My own mother contracted COVID in November. She was hospitalized twice. It was very difficult. She had to remain on oxygen for months after, and she continues to struggle today. In the Black community, we are twice as likely to die once we contract COVID, especially if we're older or we have comorbidities, which many of us have for many reasons. COVID has demonstrated what we all know to be true. Health disparities are real, and we all are responsible for changing them. Some in our Black communities have rightfully had distrust for the systems that have historically not served them well, and we have gotten vaccinated far less than our counterparts, either due to this fear and sometimes due to access. We cannot forget racist practices in healthcare and a research that has failed us in the past. We acknowledge them, but today is a different day. The Urban League of Metropolitan Seattle has responded to the needs of the community since the start of this crisis. We have partnered with the city, as we are now, other great service providers in the community to provide nearly $4 million in rental assistance, food assistance for over 2,500 residents, and we've connected over 200 people to jobs, and a pathway to housing for our friends and neighbors experiencing homelessness. We are now partnering with the city and others to begin a pathway of keeping elders, frontline workers, and those who call Seattle home alive. We have many disparities in conditions we have to address, but today we encourage all those who are eligible to get their vaccine, any vaccine that is available to you. Learning last week that my uncle and aunt had their vaccine was very surprising to me based on conversations with my uncle, but if they can do it, we all can do it, really. This is a very personal decision, though. It's a personal decision for us, for our families. Whether we do is certainly up to us and those in the household, but you know, the fears may be real and we can acknowledge them. But however, again, we are all in this together. We want everybody to just mask up, keep gathering small, wash hands, and get vaccinated when you are called. We need our educators. We need our grandparents. These people are not dispensable to us and our families. We need those that prepare the food in our restaurants. We need our grocery workers, all those that play an essential role in keeping us safe and keeping our community vibrant. So please do what you can to remain healthy and keep your loved ones healthy too. And we are just grateful to be able to partner with the city and Swedish and others to bring vaccines to more of the community. Thanks. And now I'm going to introduce Patty Hayes.
Thank you so much. Thank you for those comments. As your public health director, it is so exciting to be here and to really look at a space that is part of the bright light at the end of this long tunnel that you've heard about. Our doses have been so limited, but we know we need to be ready for when the doses come. And my heart is beginning to get full because of the commitment I know we have at the federal level and the readiness we have here in our county through these great partners who have stepped up. I've always said that addressing this pandemic is a whole community response. It's all of us together, and I think you're seeing real-time, live-time, that manifestation of the community coming together to plan, to deploy, to look creatively at addressing key needs that we know we have to do in order to do this equitably, in order for our communities, our Black and brown citizens who are here, our community members, to get access to vaccines. I am so delighted that Lumen Field will serve priority areas like the International District, Judkins Park, Mount Baker, and then open up to our community to serve underserved areas of Lake City and the Aurora Corridor. We have built our plan off of the data and the science, knowing that we need to concentrate in areas like in South King County and South Seattle, where the access and the need for communities to have extra assistance is real, and we need to address it. We have a multimodal system we're putting in place so that you don't have to have just one way and expect everyone to come and get their vaccine in one way. So we are using big systems like this. We're using community-based and pop-up clinics. We're using our mobile teams to literally go in homes for homebound elderly and for our adult family home providers. We are using pharmacies, the health system, and employers will become more and more a key partner. You've heard about some of the statistics on how we are really using our vaccine and getting it out. I'm so proud that we are seeing folks who are successfully building the bridges in our communities to establish these pop-ups so that we can work with our community-based organizations. I'm so proud to work with the City of Seattle, who has used our data to look at where we need to place access points and develop these very fascinatingly innovative ways of making sure that our community-based organizations can reach the people that we know we need to reach. So in total, the light at the end of the tunnel, I'm proud to say, includes over 400 registered providers in King County. I don't know about other counties, but those are 400 registered providers who are ready to receive vaccine when it's available, to partner with us, so that as Lumen Field begins to expand and reach large numbers of people, there are also other places throughout the whole county for all of us to find our vaccine when it's our place in time. So thank you again to these amazing partners. Thank you. Thank you to our elected officials who have stayed the course with science. I'm proud to be here in King County. I'm proud to work with all of these partners. And with that, it's my pleasure to introduce a colleague of mine from the City of Seattle, Calvin Goings, who is the director of the FAS department. Calvin.
Thank you, Patty, and good morning. It truly is a pivotal day in our shared fight against COVID. The Lumen Field Event Center is the epicenter in our battle to defeat COVID. My name is Calvin Goings. I'm the Director of Finance and Administrative Services, FAS, for the City of Seattle. I want to touch on three quick things with you this morning. First, as the department director charged with standing up this community vaccination site, I want to give you a quick snapshot of this site by the numbers. 6 weeks ago, Mayor Durkan made a very clear directive to our department: launch Lumen site. And so nearly 70 FAS employees worked with teams from across 8 city departments to convert this 190,000 square foot vacant space into a mass vaccination site. It's a site that at full capacity will provide up to 150,000 vaccines a week, making it the largest civilian-led vaccination site in the United States. The teams at FAS ordered, tracked, managed, and set up over 15,000 individual items, everything ranging from refrigerators to keep the vials safe, to vests and lanyards for our volunteers, to tables and chairs and everything in between. They managed a project tracking list of over hundreds of items each and every day. Second, I want to tell you about the people behind those numbers who have made this day a reality. It's our colleagues from across the city at SFD, the center, our community partners, and particularly the FASA teams in Yellow Jackets. Since day one of this pandemic, FAS teams have been on the front line of the city's COVID-19 response, and they demonstrated the very best of what it means to be a public servant. They helped stand up the city's test sites, they distributed critical PPE to every single member of the city team, and rolled out safety protocols for all city facilities. They could be counted on when it counted most. Standing up this site has been no different. Over the past 6 weeks, they've worked late into the night, early mornings, and over the weekends, and staff meetings have started at 5 a.m. every day because there literally has not been enough hours in the day. They did all of this work with grace, support for each other, and focus on the bigger picture. They represent the single largest mobilization of city resources in a generation. And third, to my last point, the why of we are doing this work. For us, it is simple. The community vaccination site at Lumen Field will save lives. It will expand critical vaccination assets to our residents. I want to underscore, the road to recovery goes through Lumen Field. This work is personal for us. We've all suffered from this virus, and in some cases, lost loved ones. We've been on the other end of those phone calls with loved ones, when you worry about a cough from a parent or a grandparent, and when's the next time you might see them. I can't overstate the importance of this work. I can't overstate how proud I am of the city family and our partners. I can't overstate the importance this site will have to our community. I want folks to hear me loud and clear, to hear all of us loud and clear. Seattle, help is on the way, and together we can and we will beat COVID-19. And with that, it's my pleasure to introduce Maiko Winkler-Chin, the Executive Director of SCIDpda. Thank you.
Hi, everyone. My name is Maiko, as Calvin said. My mother's been gone for about 16 years, but she's very present in my life. She was a very stubborn and loud woman, and she ate with abandon, especially when she was with her friends, because she liked to celebrate. I could also further describe my mother as a 78-year-old, limited English proficient, low-income immigrant woman with no technology access or abilities. And she's kind of reflective of many of the seniors that we have in the Chinatown International District right over there. They're very much like my mom. And if you were my mother, there was no way that you would be able to access the vaccine as it was being rolled out because of language issues and because of the technology issues required to access those vaccines. Because knowing our community, my colleagues and I knew that the vaccine rollout, just like most things with COVID, would be challenging and often inaccessible to our community. We have the highest concentration of seniors right over there, a high poverty rate, and the highest rate of non-English speakers in the city. We just weren't sure how we were going to get our people vaccinated. We've been able to do food deliveries, meal deliveries, checking up on things, helping them access schools, but the vaccines were quite a problem for us. But when the city called about vaccine clinics, we had to say yes. How could we refuse? Because we weren't sure when we would have that opportunity again. And we were lucky. Community takes care of each other, and we were able to mobilize quickly and call on community to assist in the effort. Having the neighborhood clinics were great for a few reasons. One, proximity was really, really important to our seniors because they're not necessarily the most mobile. They may be the most joyous, but they're definitely not the most mobile. They knew where the locations were because they were in the neighborhood, and the environment made them more comfortable. But the greatest thing I think about having neighbors get shots with neighbors is that they saw each other, and getting a vaccine is kind of daunting for some, and so they were able to comfort each other. And then there was that wave of people in the community that are like, nah, I'm not sure if I really want to get the vaccine. Let me wait and see what happens with other people. And those that did get the vaccine were very, very happy and enthusiastic about getting the vaccine. And so the people that were a little bit more hesitant were like, well, if my neighbor got the vaccine and they're doing okay, and if she got the vaccine and they're doing okay, I think I can get the vaccine and I'll be okay as well. And so that was great messaging for our neighbors in the neighborhood. Our initial focus was really on the neighborhood low-income senior residents, but there is no way that a small organization like ours can sustain those activities to reach further phases of the vaccine eligible residents, as well as all the businesses and the greater community. And that's why it's so great to have this big thing here happen at Lumen Field. It's a little overwhelming. For us, it's close by, it's on transit, and it's physically accessible. So I think it's great that Lumen Field is being used in such a positive way that benefits our communities. And David Young, I'm so glad that you're on this because you've worked with us on a variety of different issues, and your flexibility and your willingness to shift on a dime is going to be really, really important as we work through this process. How it looks now may not be what it looks like next week after you get your first 5,000 people through, but I totally expect you to make it work, David. David, wherever you are. You're in back of me. I also thank the city about thinking about and adjusting their work in service to the diverse people who call Seattle home, for making those adjustments and striving for equity, for looking at the numbers and being like, man, this wasn't quite working out the way that we anticipated. We kind of need to shift and change. I totally appreciate it. Keep thinking and keep being creative because there's a lot of work to be done and it's still a challenge. Because I'm still not sure whether this would meet the mom test of being accessible, but we will see. And you know that you'll hear from me if it doesn't. Thanks for calling and working with us. Call us anytime. We're happy to partner with you. And I turn it back over to the mayor once I get my mask on.
Thank you very much, Maiko, and thank you to everyone. We were going to do some question and answer, but I again just want to recognize some people. For example, Chief Harold Scoggins, who is not here today. He's often at these press conferences, but he's still out doing the work. He has led the fire department with a first-in-class, first-in-the-nation testing program and now vaccination program. And to all those firefighters who are doing that, just first testing to give people certainty about whether they have the disease, to now vaccinations to give them hope. I have to also thank Patty Hayes again. She and Dr. Durkan have been unwavering, and I don't think have gotten any sleep in the last year. I also want to thank Calvin Goings and the whole FAS team again for their leadership throughout this pandemic. To our healthcare workers, we all have a great debt of gratitude to the frontline healthcare workers and everyone working in those hospitals. But to the other essential workers who have continued throughout this pandemic to show up every single day to support every one of us in our fight, whether that's our grocery store workers, our bus drivers, our child care providers, our janitors, the people working in our shelters, our permanent supportive housing. No one stayed home. They knew they had to get to work so the rest of the community could thrive. And of course, I want to thank the governor's mother for her great work. This is actually, there's a small historical moment here. This is the first time in our state's history that the governor, the county executive, and the mayor of Seattle are all born in Seattle. And I think that that's a very positive thing. And with that, we'll take some question and answers.
How do people sign up? Where do they sign up? How are you handling the traffic mitigation in the area? Obviously, getting people here is going to be one of the big issues.
So the question was, how do you sign up? Where do you sign up? And how are we going to handle the traffic mitigation? So you can go to seattle.gov/vaccinations to sign up. We'll also have it prominently displayed on our website and other places. And we also have telephone access for those people who may not have access to the internet. We'll make sure that every TV, radio, and newspaper has that information as well. The county and public health will be giving that information. And we're going to be working very carefully on traffic mitigation. We have a plan for that as well, and it will be adapting to see how the reality of that goes. So we're trying to bring people to this with community-based organizations. But as we go out, I know that not having enough of the vaccines has been incredibly frustrating to people who are waiting for that hope. But it has had a positive sign. It has given us the ability to build the infrastructure to see what works, what doesn't work, how we can do it better and more quickly. And Lumen Field will have that too. We will start out with the 3,000 doses, but build up. And through that, we will be building. Have patience, every human endeavor. I'm sure there's going to be some missteps or things won't go as planned, but that's been this pandemic. But hope is on the horizon.
Governor, a question for you. Now that you're standing in here and you're seeing this capacity and you're seeing the framework, how do you balance, as more doses become available, getting equitable distribution across the state, but also taking advantage of this resource?
Well, the question is, how do we assure equity looking at this mass vaccination site? They are not mutually exclusive at all. We need both volume and equity, and you can achieve those by having multiple systems of vaccination. And that is one of our strategies in the state of Washington. We want both the mass high volume sites like we have here. As you know, we've started 4 basically on the state organizational standpoint. They are being incredibly effective, in part because of our private partnership with some of our business folks that are helping make this work. But we're also focusing on pop-up clinics that can go into communities of those in the Marshallese Island and black churches and the like to get access to this, as well as having multiple ways to make appointments. And again, this is one of the things I like about this operation. It will give people multiple ways to make appointments, so not just those who are really computer friendly can get access to these appointments. So it's all of the above, and if we do all of the above, we're going to both beat COVID and do it in an equitable way. I feel really good about this.
You know, Governor, it was a year ago tomorrow that you put a hold on any sort of mass gatherings at stadiums, and here you are standing next to one today. I'm just wondering, with an event like this, what metrics are you looking at to potentially reopen large events, football games, Sounders games, the Mariners next door, and really reopening Washington?
Well, we are having conversations about this on a daily basis. We hope to have in the relatively near future some resolution of those issues. Now those are made a little more difficult by the fact that we have some variants who've come up with these new mutations of the virus. But I'm more on the optimistic side because these vaccines are dynamite. They knock the stuffing out of this virus. 95%, all three of these vaccines can keep you out of the hospital and keep you from losing your life. So I'm more on the optimistic view of this. We hope to have in the near future some more information about this. I also look around at this mass gathering and I see a lot of great Washingtonians because every single person has got a mask on today, and we appreciate that. And that remains something we need to do. If we keep doing that, we're going to have some near-term progress.
Do you prioritize doses for Seattle for mass vaccination sites here?
We have a system of multiple ways of having equitable distribution. First, geographic. So we basically try to maintain as much equity as we can geographically, county by county. So basically these go to the county and there's county distributions. Now we also make some direct distributions to the city and the like, and we do our darndest to make sure that's as fair as humanly possible. But what we have found is the system we have, I think, has been quite successful in getting shots into arms. The last time I looked, we were about 15th, I think, in the nation of having people with the highest percentage of 2 doses. So it's working. Like I said, it took us 2 months to do the first million. It took us 1 month to do the second million. At this trajectory, we're gonna beat this virus fairly quickly.
Two more questions.
All right, no questions. Thank you, everyone. I also would be remiss. I really do want to thank First and Goal, but particularly Jody Allen herself and the Seahawks, who have been incredibly gracious throughout this pandemic. I hope that next January, everyone that's in this room today is here with popcorn and beers in their hand and the Super Bowl run. But until we get there, look behind you. This is a remarkable undertaking. Please, if you know someone who's eligible, help them get vaccinated. We in the city are going to do all we can. I want to thank the governor and the county executive, King County Public Health, but all our frontline workers, our healthcare workers, our hospitals. Swedish, thank you so much for your partnership and for my 2 sons. And know that hope is on the horizon. But I also have to say, because I am a mom, we're not there yet. Please, everyone, don't let your guard down now. Keep it up, wear your mask, keep your distance. We are so close, and we will get there. Thank you so much, everyone. Take care.